Hello guys, Dr. Qureshi here, and today we are going to talk about papilledema. In previous videos I have talked about pseudopapilledema where the optic nerve is swollen only in one eye. But today I found a female, or saw a female. She is 31 years old, young female. She had blurriness in the vision, blurriness in the eyes. She had headaches. She also was nauseous, and this condition was going on for a while. She went to a doctor in the past who did not dilate her, and so her condition was not diagnosed. When she came to us today, her vision was decreased. It wasn't a perfect 20/20, and she was having symptoms of blurriness and headaches. So I saw her optic nerve. Of course, we dilated her, and it was swollen. I'm going to show it to you on the pictures that we took today, and then on the OCT test that I've been talking about with you guys in several videos. We did the OCT, and she definitely had a full-blown swelling of the optic nerve head. That condition is a medical emergency, and it's known as papilledema, which means swelling of both optic nerves, so bilateral optic nerve edema. And I sent her to the emergency room immediately, and also recommending doing MRI and CT scan of the brain with and without contrast. After that, the ER doctor is definitely going to do like a spinal tap on her and then put her on a diuretic, which is a water pill. And then I'm going to see the patient back. So if you can come closer, I'm going to show you some of the pictures that we took today. And we're going to start with the fundus photos first. So let me go back here. This is the optic nerve. And if you look here, you can't appreciate the swelling here per se because it's not a 3D effect. I could see that when I was examining her, but there's definitely, you can see the margins are irregular. You see that? It's not defined. So there's swelling going on here and here also. This is classic folds. When there's a swollen nerve, you can see these folds here. Then you go to the optic nerve and I'll show you the swelling. You see that? That's swollen. All of this is edema here and in this eye as well. So that is bilateral papilledema. That's a medical emergency. So read about this condition, and again, to stress on the importance of getting your eyes dilated. So important. I've made a video on why is it important to get your eyes dilated, and now I hope you can appreciate the fact that since she never got her eyes dilated, God knows for, was it like a months to year maybe? Yeah, 31-year-old female, and she was like crying in the room. She was like, no one ever told me about this because no one dilated her. So importance of getting your eyes dilated is so crucial, because if you don't get your eyes dilated and you have the symptoms and no one is seeing deeper into your retina and eyes, then you're missing a lot of conditions that could be easily diagnosed and treated, such as brain tumor, brain mass, increased pressure in the brain. So all these conditions are related to the eyes, because whatever is happening in the brain is pressing on the optic nerve, because remember, the optic nerve, second cranial nerve, is a direct continuation of the brain. So if something is happening in the brain, as in mass or fluid accumulation, it's pressing on the optic nerve, and therefore the optic nerve is swollen, and therefore she has all these symptoms. Okay, but she finally came to us, so we are happy that we can help her. And read about it. Thank you. Bye.